Hello, my name is Rachel Shoumake, and I'm going to be going over a case study for hypoadrenocorticism, which is also known as Addison's disease, the pretender, and the silent killer. So Addison's disease, and we have the patient. Her name is Leela. She's a 5-year-old black standard poodle. She does take NexGard and HeartGard chewables once a month. She eats Royal Canin diet specifically for her breed. And the owner has noticed that her personality has changed in the last month. She's less active, more lethargic, doesn't really want to play as much. She's drinking a lot more water, the owner's noticing, even though she's not exercising to make up for the added thirst. And when they took her to the groomers, they noticed that there was less hair on her abdominal aspect, and she looked thinner. The owner declined blood work and a chem last week at the visit when this was brought up, and now that she's bringing her back in, it's because of the groomer's commentary about her looking thinner. So we have the animal not acting the same. Patient is here with lethargy, dehydration, polydipsia, diarrhea, and partial alopecia bilaterally on lateral aspect of the abdomen. She was also brought in 6 months ago and blood work was done then. Panels showed slight decrease in sodium, but everything else within normal values, so it did not concern the DVM at the time. Again, she was last brought in 3 weeks ago for diarrhea, but she declined the blood work, and then she also declined a fecal. Owner has no other concerns. So at the physical exam, we found all of those findings. We also saw that she lost 3 pounds since she was last weighed in 3 weeks ago. Her pulse is weak. We decided to do an EKG, and it showed bradycardia with a slight sinus arrhythmia. So we see that her heart rate has slowed down, but why? Her body condition score is considered a 4 due to the weight loss that is not normal for her. And dehydration was noted because the skin turgor and mucous membranes were tacky. The skin turgor, you pulled it up and you could feel a little stiffness to it. So differential we have is primary Addisons, secondary Addisons, atypical, adrenal tumor, just ain't doing right, or megaesophagus, which could be an underlying cause that has happened by Addisons, acute renal failure, or insulin pancreatic tumor. Got a lot going on down there. So diagnostics ran. We did a blood panel, a chem, and an ACTH stimulating hormone test. So results came back, and we saw that we were low in red blood cells, hemoglobin, hematocrit, and platelet count. We had high white blood cell and nucleated red blood cell values, low blood glucose and cortisol values. We also have decreased levels of aldosterone and cortisol, and we know that aldosterone and cortisol is a glucocorticoid and a mineralocorticoid that is necessary for healthy adrenal function. We also found low albumin levels, and she's hypoglycemic. In here we have more findings and results. Thankfully, we did not see any abnormal findings in the kidney values, glomerular filtration rate, BUN, creatinine levels were all good. And after stimulating pituitary gland, we saw that there was no increase in blood cortisol, which helps confirm the diagnosis of hypoadrenocorticism. All right, so treatment. We're going to be giving the patient fluids, Plasma-Lyte, with electrolyte additives, glucose, calcium gluconate, it's the same thing, sorry, and cortisol replacement drugs to be given in the clinic while she's here. We can administer a mineralocorticoid once she seems not so hypovolemic and her blood pressure ranges are within normal values. And when she goes home, this is going to be typically a lifelong treatment for this animal to keep up with this. She's going to need right now electrolytes weekly for the first 4 weeks. Prednisone tablets will go home and she'll take that for a week, and then we'll come back to do more tests to determine if she needs to go another week, or we can just go ahead and start monitoring with the mineralocorticoids. Potassium and sodium levels are also going to be monitored for the next course of several months, because we know that Addison's and Addison's crisis can occur due to electrolyte imbalance, which is why we saw that she had hyponatremia and hyperkalemia, and this disrupts the sodium-potassium pump that allows the cells to function normally. Another thing that the doctor wants to recommend is a supplement of adrenal glandulars, And it's just little supplements that you take that can help support organ health. And then Procortin V is going to be given for 25 days once we're done with prednisone, and then over time we can consider dose reduction based off of test results and maintenance. So one thing I like to mention is glucocorticoids are important for maintaining homeostasis, especially during stress, and we know that our adrenal glands are responsible for the fight and flight and also being able to bring us back down from that fight or fight mode. And then in Addison's case, it's the opposite, where the animal is not able to deal with stress, is not able to healthily distribute the cortisol that's being created. The patient was diagnosed with this at an early stage. It could have progressed to a more acute form of Addison's or even have gone into Addisonian crisis, which would have required an emergency visit. So long term, we're going to be doing serial evaluations of electrolytes every 3 to 4 months while she's taking mineralocorticoids for the rest of her life. And we're going to make sure that the client is educated and really understands how this disease works so that she can help her pet to the best of its ability. And here's my works cited.